How to stop child allergic rhinitis sneezing fits. Imagine your child sneezing nonstop during allergy season, feeling uncomfortable and tired. Allergic rhinitis, or hay fever, is a common condition that causes sneezing, a runny or blocked nose, and itchy eyes. It happens when the immune system overreacts to allergens like pollen, dust mites, pet dander, or mold. The good news is there are proven ways to help reduce those sneezing fits and make your child more comfortable. First, identifying and avoiding the specific allergens is key. During high pollen seasons, keep windows closed and use air conditioning or fans with sealed windows. This helps prevent pollen from entering the home. For indoor allergens like dust mites, use dust mite-proof bedding covers, wash bedding regularly, and vacuum carpets and stuffed toys often. Keeping indoor humidity below 50% also helps reduce dust mites and mold growth. If your child is allergic to pets, try to limit contact and wash hands after touching animals. In some cases, rehoming a pet might be necessary if allergies are severe. Medications are often very effective in controlling allergy symptoms. Antihistamines are usually the first choice. They block histamine, a chemical released during allergic reactions, which causes sneezing and itching. These can be given as pills or nasal sprays, depending on what your doctor recommends. Intranasal corticosteroids are considered the most effective for ongoing symptoms. They reduce inflammation inside the nose and help prevent sneezing fits when used regularly. Saline nasal rinses can also be very helpful. Rinsing the nasal passages with saline solution clears allergens and mucus, providing relief. Decongestants may help with nasal congestion but should be used cautiously, especially in children under 6, and only for a few days. Overuse can worsen symptoms or cause side effects. For children with asthma or more severe allergies, leukotriene receptor antagonists like montelukast might be prescribed, but they are generally less effective than corticosteroids. Sometimes, other medications like cromolyn nasal spray or anticholinergics are used, but these are less common as first options. Consistency is important. Medications should be taken as directed, especially during allergy seasons, even if your child's symptoms improve. Combining treatments, such as antihistamines with corticosteroids, can be helpful for severe cases, but always follow your healthcare provider's advice. For children with persistent or severe allergic rhinitis that does not respond well to medication, allergen immunotherapy may be considered. This involves allergy shots or tablets that gradually help the immune system become less sensitive to allergens. Such treatments should always be supervised by a specialist. Supporting your child's environment is also helpful. Encourage frequent hand washing to reduce allergen transfer, keep the home clean, and avoid smoke, strong odors, or other irritants that can worsen symptoms. Remember, it is very important to consult a healthcare professional for an accurate diagnosis and a personalized treatment plan. They can help determine the best medications and strategies for your child's specific allergies. Always use medications as prescribed and avoid overusing nasal sprays, especially decongestants, to prevent side effects. Regular follow-up appointments allow your child's treatment to be adjusted as needed, helping to control sneezing fits and improve their overall quality of life.